Welcome to Plant-Powered Metro New York's live stream Q&A on kidney nutrition, why beans and bananas beat beef. My name is Lianna Levine Reisner, and I serve as the Network Director of Plant-Powered Metro. Our mission is to empower you and your communities to find better health and overcome chronic disease with whole food plant-based nutrition, an area of growing scientific discovery that continues to show how powerful plants are in our day-to-day health and healing. We're so pleased to be joined in presenting this event by our friends and colleagues at Rise Up East New York, a community-led and community-driven movement to prevent disease and promote wellness in the East New York neighborhood of Brooklyn. Now, if you, like I, have never been through medical school, the kidneys are a particular mystery. We've heard of them, we know they're there, but they're not quite as noticeable or lovable as, let's say, our hearts or brains or lungs. Kidneys are the body's miraculous filters and more. We're going to demystify our kidneys this evening and dig into the topic of how nutrition can keep kidneys going strong, and also give you practical tips and tools for eating every day. Tonight, we're joined by two nutritionally informed doctors from the New York metro area who specialize in kidney health. Shivam Joshi is an internist, nephrologist, and plant-based physician practicing at NYC Health and Hospitals Bellevue in New York City, and a clinical assistant professor at the New York University Grossman School of Medicine with research interests in plant-based diets, fad diets, and nephrology. You can follow him on Twitter at sjoshiMD. We also have Leigh Ettinger, who's been serving for nearly 17 years as a pediatric nephrologist at Hackensack University Medical Center in northern New Jersey. And in 2021, he founded the Dr. Herbivore Practice, a telemedicine practice that focuses on pediatric obesity, plus KidneyStoneDoctor.com, which helps adults who've had kidney stones prevent their recurrence. All right, so let's bring the doctors on. Welcome, Dr. Joshi. Welcome, Dr. Ettinger. Great to have you.
Thank you for having me.
Thanks for having us.
Excellent. So I'd like to start with Dr. Ettinger. You work with kids. You bring things down to basics. Can you tell us what are the essential roles that kidneys play in our body? What do they do?
Well, I used to think the brain was the most important organ in the body, and then I figured out who was telling me that. So it's interesting, actually, more blood flow goes per heartbeat to the kidneys than to the brain. And all that blood flow is going to the kidneys so that the kidneys can clean the blood and remove extra water that you don't need and extra waste that you don't need. That's what you pee out. The kidneys have a lot of different roles. They also help regulate your blood pressure. They help regulate your amount of blood in your blood, amount of red blood cells in your blood. They regulate the acid-base balance of your body. They play a role in growth, and they're very important. And maybe you have one, maybe you have two. It's nice that we have a backup that we can share with others.
Excellent. Thank you. So, Dr. Joshi, what are some of the signs or symptoms of chronic kidney disease in adults, things that we should look out for before it becomes serious?
Yeah, so that's actually one of the unfortunate parts about kidney disease is that it's hard to know that you have a problem unless you get blood work. And unfortunately, when you start to feel it and you develop these symptoms of kidney disease or the signs of kidney disease, it can be a little too late. And people often have advanced kidney failure, and I've seen that many a times. But so it's important to have blood work done, to see your primary care doctor periodically, to be checked, especially if you're at risk for developing kidney disease. So the big risk factors for developing kidney disease are diabetes, high blood pressure, obesity. So you have those problems, you definitely want to have blood and urine testing to make sure you don't have a kidney problem, especially if you're on medications for these conditions. For the symptoms of kidney disease when it's advanced can include a decrease in appetite, nausea, vomiting, confusion, chest pain, shortness of breath, leg swelling, lack of energy. But usually like I said, when patients have these symptoms, it's usually pretty advanced and patients are close to needing dialysis at that point. So we like to If someone does have kidney disease, we like to catch it early, and the way to do that is to be tested.
What are the specific markers that doctors are going to look for?
Yeah, so the big one is this blood test called a BMP, or a basic metabolic panel, which kind of gives us information on the various things the kidney is doing to control the electrolytes. So that will check sodium and potassium and things like that. But the most important one is a creatinine test. And we use that to calculate kidney function. There are other ways to test for kidney function, but that is the most common way that we test for kidney function in this country. And then the other thing that we look at in the urine is we do a urine analysis, or we look for protein or blood. So those are the two tests that we perform to check for kidney disease.
That's great. So, Dr. Ettinger, what about the pediatric population? What are some of the risk factors or symptoms that we see in children that either point to damage or disease of the kidneys?
Right. So the kidneys are important for growth. So sometimes a child who's not growing well, it might be because of kidney disease. So a pediatric kidney doctor might see someone who's failing to thrive. Also, pediatricians are routinely checking urines, and we might see someone who has blood or protein in the urine. We might see someone, or the pediatrician detects high blood pressure. Also, a lot of prenatal ultrasounds raise concerns about what the kidneys are looking like even before birth. So we might see a baby soon after birth to follow up on any anatomic problems that the kidneys have. In pediatrics, we also see kids for bedwetting. That can sometimes be a sign of a kidney problem too.
Very interesting. So we all have chronic kidney disease, which is probably one of the biggest issues that adults face. And many of these topics that you've just addressed for the pediatric population. What are some other common health conditions that affect the kidneys? Dr. Ettinger, will you tell us a little bit more about stone formations? Mm-hmm. That seems to be one of your specialties.
Right. Yeah. So I enjoy talking to families who've had stones to help reduce the risk of more stones forming. An adult who's had a kidney stone has a 50% chance of having another kidney stone within 5 years. So nowadays we do blood tests, we do 24-hour urine tests. We can do a simple cheek swab genetic test that can identify if you have one of 40 known genes that can predispose you to kidney stones. So with that information, we can help tailor either dietary changes or medicine to reduce the risk of kidney stones. And so the interesting thing about someone who's following the plant-based diet and encouraging families to follow a plant-based diet is that some of the general recommendations for the general population to reduce their risk of kidney stones is actually to reduce animal protein intake. Vegetarians have about 50% chance less of having a kidney stone compared to meat eaters in population studies. So if I can meet someone who has never even had the concept introduced that they should be eating less animal proteins, I can kind of sneak that in and introduce them to the ideas of a diet.
That's great. And what other kinds of kidney issues are more common that we should be looking out for?
We also see people with a condition called rhabdomyolysis. So that is when there is either crush injuries to muscles or someone overexercises and they have muscle breakdown products traveling through the bloodstream that get stuck in the filters of the kidneys. And you might feel very sore after a workout or having a trauma to your muscles and then be peeing blood. It looks like blood in the urine, but when looking under the microscope, it's not actually red blood cells in the urine. It's actually pieces of muscle that are staining the urine like that. So that can be very dangerous. In the pediatric world, I've seen it in some of the high school football players. I've seen it in a young woman after spin class. I saw a young man who had one of these magazines that was like, "Get your body ripped this weekend." And so he worked out all weekend and then was peeing blood on a Monday morning. So we unfortunately see that, and that can be damaging to the kidneys. So when they have blood in the urine after a workout, that's another concern.
Mm-hmm. And Dr. Joshi, how about you? Is there another common kidney issue that you see in your patients?
Kidney stones are a big one. I'm glad that Dr. Ettinger brought it up. I actually had kidney stones myself almost 20 years ago. And it was actually eating a lot of animal protein. I was in high school, and the football coach said that he could use me for my height, but I needed to put on some more muscle to play on the team. It was foolish of me to even think that. So what I ate was all these Hungry Man TV dinners, these Michelinas, and you go into the freezer aisle and they have these TV dinners, and they have the different containers in them, and you microwave them, and you eat it. And these dinners are just full of animal protein, saturated fat, all these unhealthy things. But in terms of kidney stone formation, at the time, I didn't know what I was doing would put me into having a kidney stone. But it was high in salt, which is a big risk factor for kidney stones. High in animal protein, as Dr. Ettinger mentioned, a big risk factor for kidney stones. And then the location, which was in Florida, being very hot, I wasn't hydrating. So that's the third thing in this recipe for disaster that led me to being in the emergency room, passing a kidney stone very painfully. And the irony is that people often think that eating plants will give you a kidney stone, but I've been eating plants for years, and I haven't had a kidney stone yet. And what the literature shows is that if you eat a plant-based diet, your risk of developing kidney stones actually decrease for a lot of reasons.
Mm-hmm.
Yeah,
Go ahead.
May I just add? Yeah, the concern about the plants is the oxalate. That oxalate is made by the plants to actually bind calcium that the plant is absorbing from its roots. And then you eat the plants and you get that load of oxalate. And the most common kidney stone is a calcium oxalate stone. And so people are concerned, if you're eating the oxalate, that'll cause the kid to go into your bloodstream and to go through your kidneys and form a kidney stone. But happily, when you're eating the oxalate in the plants, hopefully you're getting calcium too, and binding the oxalate up in your gastrointestinal tract and pooping it out before it gets into your bloodstream and into your kidneys to form a kidney stone. I do have an interesting story about a young man, a similar story to you, Shivam, that he was very petite. He was a teenage boy, he was very petite. And so his pediatrician suggested that he eat Kind bars. And if you know these Kind bars, they're like dark chocolate and nuts, right? So he's eating four of these Kind bars per day. And there's a lot of oxalate in dark chocolate and nuts.
Right.
And he actually ate himself into a kidney stone by eating 4 Kind bars a day. So there's a situation where, and his 24-hour urine showed a tremendous amount of oxalate in it. So there's a situation where eating those particular plants did get him a kidney stone. But yeah, as you said, the studies do show that the vegetarians and plant-based people are less at risk of kidney stone because hopefully they're getting that calcium with the plants to bind up the oxalate before it's absorbed.
Great.
Right. And certainly, if you wanted to have a kidney stone on a plant-based diet, and I'm not sure who would want to, but you certainly could do it, like you mentioned, by eating just exclusively foods or products that are high in these oxalates: chocolate, nuts, star fruit, raspberries, spinach.
Rhubarb is the other classic.
Rhubarb, yep.
Yeah, I don't think we could OD on rhubarb. Yeah. So before we go even farther into the nutrition topic, I do want to just pause and ask a question. This was something I learned from one of our volunteers. What is the connection between the use of ibuprofen and kidney damage?
Yeah. So there's a big connection. This class of medications are called NSAIDs, non-steroidal anti-inflammatory non-steroidal anti-inflammatory drugs. These medications can affect the kidneys in multiple ways. They can cause an allergic reaction. They can decrease blood flow to the kidney. They can raise blood pressure. I actually saw a lady today. She was having a foot pain. She sprained her right foot, and she was having pain. And her blood pressure had been controlled. And she comes to me today saying, "Doctor, look, my blood pressures are all high. I think it's the stress from, what's going on in world events." And I said, "It's possible, but, and my routine question, I asked her, "Are you taking anything for pain these days?" And she said, "Oh yeah, I sprained my foot, and I'm taking." She was taking Celebrex, and this medication, this whole class of medication, ibuprofen is one of them, naproxen, Celebrex. All these medications can raise blood pressure, which is actually the #2 cause of kidney disease. So indirectly, they can cause kidney disease. They can promote the progression of kidney disease. But more commonly, what happens is that they decrease blood flow to the kidney, and they can reduce the function of the kidney transiently. And if it's not rectified, that can translate into permanent damage. And we see that time and time in patients who are in a lot of pain, and they can't get other pain medications for some reason, or they're on another medication that's affecting the blood flow to the kidney, and that combination can cause problems. So what I tell my patients is if you have kidney disease, avoid these medications to avoid problems. In this situation, Tylenol is generally the go-to.
Got it. So are there actually good alternatives to reducing pain or inflammation without organ damage?
Dr. Ettinger, you want to take this one?
Yeah, so a lot of families or a lot of people, they really like ibuprofen. So if they're going to take the ibuprofen, we say to make sure you're well hydrated at the time, because it's usually a combination. If you're a little dry, dehydrated, that the ibuprofen can really hurt the kidneys. So if you're going to take it with a lot of water. But other than that, there's other classes of pain medicines that we would recommend.
Mm-hmm. Thank you. Excellent. So let's go back to food now. What's the ideal way of eating that can help us maintain kidney health? Like, let's not go into a kidney stone diet or kidney disease diet. What can really help us stepping back and maintaining health for both kidneys for your whole life?
Yeah, so what I say is that the foods that are healthy for a kidney are the same foods that are healthy for the rest of your body. The foods that you should be eating for diabetes, for weight loss, for blood pressure, for for all health problems. And what does that mean? It's a diet that is predominantly in unprocessed whole plant foods, like fruits, vegetables, whole grains, beans, lentils, nuts, seeds, things like this. The problem is that there's a lot of confusion and misinformation. If you Google a diet for kidney disease, it will produce a list of things that you're supposed to avoid. And on that list are pretty much everything that I just mentioned: fruits, vegetables, whole grains, beans, lentils. Because the old thinking used to be that all these foods were high in potassium and phosphate, which are bad for the kidney or bad for health for people with kidney disease. But now the new thinking is that actually these are some of the healthiest foods on the planet. And the reason many of our patients are in this situation is because they weren't even eating these foods in the first place. What they were eating was all this processed, unhealthy food. And now we're telling them to still not eat the healthy food, and we're not giving them a chance to even try and get better. And it's just, it's an endless cycle of sickness and medications, and people sometimes ending up on dialysis. So it's very unfortunate. So what I tell people is to go back to the basics, eat their beans, eat their greens, making sure they're getting their veggies. And that's the best you could do, not just for your kidney, but for the whole body.
Great. And so actually we got a question from the audience. How much potassium can a person with kidney disease have? Would you say don't worry about it in this situation, or should there really be some attention to it?
Yeah, so the guidelines have changed over the years. When you look at the guidelines, they've changed. They used to specify limit it to a certain amount, less than 3 grams, less than 4 grams of potassium per day. Then they realized that they just made this number up and that there's no science behind it. And then it slowly changed to say, well, we shouldn't really look at how much potassium you're taking in. And really we should be seeing is that what we should be encouraging is the consumption of these healthy foods and then watching your potassium at the same time. If your potassium goes high, it could be from the food, but it could also not be from the food. It could be from medications. It could be something else that you're doing. Constipation can do it. Some of the medications we use to even treat kidney disease, like ACE inhibitors and ARB medications, can raise potassium. And it's not necessarily what people are eating that's doing it. So if you're in a situation where you have kidney disease and you want to eat a plant-based diet, discuss it with your primary care doctor, your nephrologist, so that you could do it safely and be monitored some people do run into trouble, but most people do just fine.
Mm-hmm. But is it the case that many doctors will know about this information, or is it still sort of getting out there right now?
It's getting out there, so you might run into a situation where the doctor does not know about it. But you may find someone that has listened to a talk or read a paper that Dr. Ettinger or I have written, and they may be informed, and maybe they may be up to date.
Great. I remember hearing you, Dr. Joshi, I think the first time I heard you speak, you were giving some kind of grand rounds talk about the role of, and maybe it wasn't you, but somebody else, but the role of fiber in the diet and how the fiber sort of helps to flush the excess out. We know that that's important for things like colon cancer and other hormonal issues, but can you speak a little bit to that, how that affects kidney health as well?
Yeah, fiber is really important for kidney health. There's association studies that for every gram of fiber that people consume in kidney disease, that the associated risk of mortality will drop by 10% or so, which is substantial. And I think that just goes back to eating these healthy foods. One of the great parts about eating these healthy, unprocessed plant foods that they are high in fiber. And what happens is that it changes the gut microbiome to be a healthier microbiome that produces less uremic toxins. And when you have a declining amount of kidney function, producing less toxins is good, because then those toxins don't circulate in your body and cause problems that would ultimately need dialysis to fix.
Excellent. Thank you. Dr. Ettinger, is it also appropriate and effective to feed children a whole food plant-based diet for kidney health? And I'm just curious if there are any considerations for children.
Right. Well, for young children, they have smaller stomachs and they're usually a lot more active running around the playgrounds. And so the whole foods plant-based diet can sometimes not have enough calories for them, or have such high fiber that it can be very filling so that they're not eating enough calories over the course of the day. So sometimes what is encouraged is for the elementary school ages, for example, to have a higher fat diet. When I think about the whole foods plant-based diet, I think about all the benefits for weight loss and for disease prevention, and sometimes even heart disease reversal and diabetes reversal. But for a young child, we say in the business, you only get one chance to grow. By the time you're through with puberty, your bone plates fuse, your growth plates fuse, you're done growing. So it's really important that they get enough calories and enough fat, especially helpful for brain growth at that age group too. So for a younger child, we're not looking at disease reversal, maybe disease prevention, but we definitely want to make sure that they're growing. So and getting enough of the essential vitamins and minerals. So the pure whole food plant-based diet that an adult might use to lose weight is not appropriate necessarily for a growing child. In the teenage years, they're done growing, and if weight is an issue, then yes, it's time to start reducing the fat intake and focusing on the whole food plant-based. And we're trying to set them up for a lifestyle, a lifetime of healthy eating too, still getting enough energy for being active and doing all the things that a teenager wants to do. And I really think about it, especially because cardiovascular disease has in young when, for example, an autopsy report that shows that young kids in this country already have atherosclerotic plaques building up, or when I see teenagers with high blood pressure and I look at the heart is a muscle. It's pumping, it's exercising when it's making a high blood pressure. So we actually see kids already with changes in the heart from even just a few years of high blood pressure. So when you start to see what we call end organ damage, end organ changes from the standard American diet, it's time to get more serious about encouraging a healthier nutrition.
Great. Yeah. And let's talk a little bit more about some of these other diseases that sort of interplay with kidney disease. We see them commonly together. So nearly half of New Yorkers are either diabetic or pre-diabetic. Can you tell us, Dr. Ettinger, what's the connection between diabetes and kidney disease specifically?
Right. So we certainly diabetes, type 1 and type 2 diabetes can affect the kidneys. It usually takes years or decades, but actually in my fellowship, I did research on newly diagnosed type 2 diabetics, teenagers, who had only recently been diagnosed with the diabetes. But what's probably been happening is over the years leading up to the diagnosis, their blood sugars were creeping up, maybe their blood pressures are creeping up, and they were already showing signs of kidney damage in the form of a protein called microalbumin that can appear in the urine in the first stages of damage from diabetes. What diabetes does, the constant high blood sugars causes these things called advanced glycosylated end products, AGEs, to build up in the filters of the kidney and damage the filters of the kidney. And the first step in that process are these microalbumin proteins appearing in the urine. Later, full proteinuria shows up in the urine. And then later after that, you start to lose kidney function. As Dr. Joshi described, your creatinine starts to creep up. So, and my research in fellowship showed that this was process was starting to happen in the teenage years. So as best as we can, trying to prevent or treat diabetes, this is type 2 diabetes, in even the teenagers, can help them prolong their kidney health.
That's great. And actually, you just mentioned it. Nicole asked, how do whole foods affect proteinuria? Can you sort of dissect that a little bit and maybe explain a little bit more about what that means for the lay person?
Yeah, I don't know of any particular studies that specifically looked at protein in the urine, say before and after a whole foods diet intervention. I don't know, Dr. Joshi, do you know of any specific studies that looked at how diet affects protein in the urine? It's not that you're eating too much protein and it's spilling over into the urine. There should be no protein in the urine. And when proteins does show up in the urine, it's already probably a later stage of kidney disease that's happening. So I don't know about any intervention studies. Do you?
In the adult literature, there's a few studies. They did a couple trials where they would feed people animal protein and then plant protein, or a proportion of plant protein. And there's 3 or 4 studies like this. And what they show is that people eating plant protein or a combination of plant protein or just less animal protein had less protein in their urine. The differences were small. They weren't, home runs or large reductions, but it was kind of interesting to at least see this decrease in a few of the studies to suggest that there may be a benefit to eating plant protein. But like we've all been saying, is that eating healthier will affect these dreaded diseases like diabetes and hypertension, which are bigger drivers of the protein in the urine. So I think if you could treat the diabetes and the blood pressure and get rid of it even, that's more important than trying to mediate it directly.
I just want to emphasize also, thank you, that was helpful. I just want to emphasize also that decreasing proteinuria doesn't necessarily mean the disease is gone, the kidney disease is gone, or that the kidney disease is even reversed. What's likely happen is that decreasing protein in urine, the protein is a sign that there is a kidney problem, but the protein itself traveling through the kidneys irritates the kidneys and causes further progression of the kidney disease. So decreasing protein in the urine at best will slow the progression. If you're headed for dialysis in 5 years, decreasing the protein in urine maybe will get you 6 years or 7 years or 8 years. That's the goal of decreasing protein in urine, is to slow progression of disease.
Great, thanks for clarifying that. That's really excellent. So we talked about diabetes, we talked about proteinuria. Can you also discuss the link, Dr. Ettinger, between cardiovascular disease and kidney disease?
Well, you think about cardiovascular disease as the tiny blood vessels, the coronary arteries that are feeding your heart muscle as being clogged up. Well, the same thing is happening in the kidneys, that the kidneys, you have a million of these filters that are very tiny blood vessels. So whatever is happening in the coronary arteries is likely to also be happening in the kidneys. And these are called end organs because there's really only one path of the blood through. it's happening in your liver too, but the liver has so many paths for blood to travel that you don't develop liver failure, example. But there's only one way in and out of the kidneys. So that's another organ that's damaged by this cardiovascular disease. The cardio is the heart and the vascular is the blood supply. So when the blood supply to the heart is narrowed, is blocked, is filled with plaques, you can believe that it's probably happening in the blood supply of the kidneys too.
That's so helpful. I had never thought about this or learned about this before. Just thinking about, where does stuff go in the body? What path does it take? How many paths are there through the liver or the kidneys? It's fascinating.
Right. Yeah. So yeah, it's probably happening in all the organs, but you have so many backup routes for blood. You don't have backup routes for blood into and out of your brain. So that's why there are people having strokes who have cardiovascular disease. They're having kidney failure. Vision problems also. There's only one path in and out of your eyes, the back of your eyes. So all these are quote unquote like end organs. There's only one way in and out of them. But
that's helpful.
Not for your lungs, not for your liver, your spleen. Those other organs, they're well perfused and are able to work around blockages, whereas these very important organs like the kidneys, for example, don't have. But it's kind of nice. You have two kidneys and you can live on one. So if anything, that's the backup plan, is that you can start to lose kidney function and not really get into trouble until you've lost more than the equivalent of one whole kidney.
Yeah, but in all these cases, though, cardiovascular disease, diabetes, and kidney disease, plants are a big piece of the answer. Can you, maybe Dr. Joshi, tell us a little bit more, how much, if we had a scale, like how much does nutrition matter versus other kinds of interventions that we might take in our lifestyles?
I think nutrition matters a lot. It just depends on the individual patient's circumstances and the disease process. Like type 1 diabetes can get better by eating healthier, but it's not going to go away with eating healthier. But type 2 diabetes, you could see significant improvements and even get rid of type 2 diabetes. With kidney disease, it's a little bit harder to reverse the disease process, if not impossible. In many cases, it's very difficult to reverse it. The best we can hope for is to try and slow this deterioration of the kidney function down. But nutrition is a big part of it. If you eat unhealthily and are eating a lot of dietary acid, a lot of dietary phosphorus, then us as physicians, we have to give more medications to neutralize those effects. Or if you're eating a lot of salt, for example, or a lot of animal protein, then your blood pressure might be high, and we have to give more medications to neutralize those effects. And the same thing with diabetes. If you have someone that has a lot of insulin resistance and they're hyperglycemic, more medication. So nutrition and the corollary exercise are big factors in someone's health and can really change things.
Excellent. Let's talk now about when things go far down the road, and dialysis is really the next step. Can you, Dr. Joshi, explain to our audience a little bit more about what dialysis is and whether it's preventable and how?
Yeah, so dialysis is a life-saving therapy that is done for patients who have the severe form of kidney disease. There's 5 stages to kidney disease. The 5th stage is the most severe, and that's stage 5, also known as kidney failure or end-stage kidney disease. And generally at that stage, patients start dialysis when they progress farther within that stage. And dialysis replaces the function of the kidney. It's not 100%. It doesn't even come close to being 100%. And it's not, and just because you're on dialysis doesn't mean that your life will be the same as if you never had any kidney problems. It's a kind of a holdover. It's not as good as having a normal kidney. The idea is for everyone on dialysis to try and get a kidney transplant if at all possible. But because there aren't enough kidneys to go around and there's too many people who need a kidney, dialysis kind of serves as that in between therapy. And what happens is that patients typically go to a dialysis clinic 3 times a week to get dialysis for 3 to 4 hours at a time, and then they come home. The newest development within the past few years is trying to do the dialysis at home. So some people actually do this at home overnight in various ways. But the best thing is to, one, hold on to your kidneys if you can, and two, if you can't, try and get another kidney from someone.
Mm-hmm. On that topic, actually, this was something else I learned. So one of our volunteers, Elaine Perlman, big shout out to Elaine, who I know is watching us tonight. She is a kidney donor and a proud one at that. And she told me that there are apparently 97,000 Americans who are waiting for a kidney, and New York is ranked 49th in the nation for kidney donation. So I'm actually, there's a few questions we could talk about with this, but for anyone who may be on a transplant list, what do you recommend that they do immediately when it comes to nutrition?
Well, first, I want to give a shout out to Elaine for an amazing act of kindness. That's truly one of the most generous and nicest things a person could do, is to give part of their body, their kidney, to someone else to save someone else's life. So that's really selfless and generous. To answer your question, now what remind me, what was the question?
Oh, that's okay. For anybody who's on a transplant list and is waiting and hoping and praying, what do you recommend that they do with their eating patterns daily to give them a better chance?
Right. So first thing is, to be nice to your friends and family in the hopes that they like you enough to give you a kidney. If for those who are lucky enough to have friends and family to close enough to donate, that is a big help in a way many people get their kidneys. In terms of nutrition, eating healthy again is very important. The sad reality is that many people on the wait list are on dialysis, and those folks don't have a good long-term survival or even short-term survival. Like I was saying earlier, dialysis does not replace all the functions that the kidney does. And because it's a suboptimal therapy, it's not a kidney doing the work of a kidney, this leads to problems. And many folks, almost 50% of people on dialysis, unfortunately pass away at 5 years. It's as bad as some early stages of cancer, and patients don't fully appreciate that. They don't fully know this information, and everything that you could possibly do to be healthy as much as you can, to be around, is helpful. Stop smoking, exercising, eating healthy, doing all these things. And even if you're not on dialysis and you're close to dialysis, the risk of dying is higher than someone who doesn't have this kidney problem. And the big cause of death is actually cardiovascular disease. So anything you can do to lower your risk is helpful.
Thank you.
Can I add some? Mm-hmm. One of the interesting things that has happened over the past few decades is that these two major dialysis companies have a basic monopoly, DaVita and Fresenius. They run all the dialysis units in the country. But that's given them very large data sets and data pools to figure out people on dialysis, how are they doing? And some of the interesting things that they have found is that people on dialysis who don't have a job tend sooner. It's a part of the motivation.
Dr. Ettinger, we lost you for a second because of your internet connection, but you said people on dialysis who don't have a job
tend to die sooner on dialysis. So all of a sudden, all these social workers across the country were trying to help people on dialysis get jobs. It gives someone a motivation, it gives someone a social scene, it gives someone a reason to live, a part of having a purpose. So another thing that was found was that people with a low albumin on dialysis would die sooner. And albumin is a reflection of your protein intake over the past month. So all of a sudden, nutrition became even more important. And what was found was like you have like a little old person on dialysis who would go home and just have a little tea and toast, and would kind of dwindle away. So people were really trying to pay attention to get nutrition better for people, because that would help them survive. And nutrition is also a sign of social connections, because people go out to eat. They have friends over for dinner or something like that. So now the social workers and dietitians are trying to help people with their nutrition as a sign of, again, having a purpose, having a social life, having friends and family. So all of that has been shown to prolong survival on dialysis, which, as Dr. Joshi said, can be pretty rough.
I love that you bring that up too, the social support and connection, and as a key, that lifestyle factor here. Part of lifestyle medicine we know is about the social support networks that we have. So great to bring that up. Thank you. And Dr. Joshi, for anybody who might be considering donating a kidney, what do you recommend that they do to maximize their kidney health before and after the procedure?
Yeah, I think just trying to be as healthy as possible, doing the things that we mentioned. A big cause of kidney failure is diabetes. Second most common is hypertension. So if these things led to kidney failure and you're lucky enough to get a second chance at life and get a kidney, you certainly wouldn't want to have the same situation repeat itself. So anything you could do to treat the diabetes or high blood pressure to prevent losing that transplanted kidney is paramount. And it's just saying the same thing that we said before: eating healthy, exercising, not smoking, making sure you're taking your medications and following up with your doctor. And that, is easier said than done, because for the past 2 years, a lot of patients have not seen their doctor. And even now the pandemic is not over, but in a better place, we still aren't seeing all the patients that we used to see. And it's unclear if they are getting the care that they need. So if you've lost touch with your doctor, make sure you get in touch, make sure you're taking your medications. Just because you've run out of a medication doesn't mean you can stop taking it or it's done. I see that so often. You probably need a refill, and you need to get that refill from your doctor. And that medication was prescribed to you for a very good reason, and it's important that you don't stop it. So just a lot of the basics go a long way.
Great. Yeah. I want to lighten it up a little bit and just ask the two of you more about how you personally eat, knowing what you know about kidney health. And certainly, let's start with you, Dr. Joshi. Having had stones before, what are some considerations that you take into account when you're making your own meals?
Yeah, well, I'm getting older. I'm not 15 in high school, and I'm getting to the age of the patients that I see, and I don't want to have diabetes. I know what happens with dietary and lifestyle indiscretion. I know what diseases happen, the complications of those diseases, and how bad life can be. So that's a motivator for me on a daily basis. And right before we were talking, I had this bowl of kale and broccoli and some beans in there, and it was delicious. 10 years ago, when I was in med school, I was probably eating pizzas and fried stuff, French fries and things like that. But my diet has changed a lot, and I try as much as I can to practice what I preach. I eat fruits for breakfast. I try to eat wraps or sandwiches lunchtime on the go, and then dinner we usually try and eat some veggies or something like that.
Great. How about you, Dr. Ettinger?
Yeah, I turned plant-based almost 8 years ago, and very pleased to see my health improve. I wasn't really having many health problems, but hey, my blood pressure was creeping up and my weight was creeping up, and a lot of subtle little things that kind of creep up on people. And I didn't realize it until I took a good look at my health and what I was eating. And so I've been plant-based. I try to be whole foods, but a lot of processed foods unfortunately sneaks in to my diet. I'd like to do better at that, but I am very careful about salt. I've had a long interest in blood pressure. I did an 11th grade science project on blood pressure, which I'm proud to say won 4th place at the local science fair. I earned $5 prize that I spent at McDonald's.
Ironic.
I didn't learn the lesson then, I guess. But now I'm very cautious about salt. And it's interesting when I eat out, it's like a blast of salt. You just don't realize how much salt is in restaurant food when you have no control. So I'm very, very cautious about salt. And my blood pressure is great, and I'm very happy with all my blood tests and stuff. So it's been a really great way for me to thrive. And I enjoy talking to community groups and working with people and helping other people understand the benefits of the plant-based diet.
That's great. Thank you. So we have a few questions from our audience that I want to just pop in here and before we wrap up. On the topic of salt and sodium, Linda asks, what might a low sodium level on a blood test mean? I don't know if this is specifically related to kidney health, but let's unpack this a bit. Would one of you like to take that?
Yeah, I can jump in. So it depends on how low. The devil is in the details, and it may be just a spurious, up and down with blood tests, or it could be a sign that something is going on, especially if it's very low. So the normal level is 140. And if you get, something like 137 or 136, we're not too concerned. But if you're getting a 130 or 129 or, 120s, then that's something that needs to be looked into by whichever doctor that ordered that blood test or a kidney doctor. It could be a sign of something going on. It could be a heart problem, a kidney problem, a liver problem. It could be a side effect from a medication. It could be any number of things, but generally that's not good, especially. And if it goes below 120, that's the danger zone. That's when people can start having seizures and they need to be hospitalized. So we definitely don't even want to get even close to that. We want to keep it in the upper 130s, close to 140. So if the sodium level is low, how low, and definitely talk to your doctor about it.
Great, thanks. Louise asked an interesting question. I don't know if I understand it fully, but she says, what about lupus and nutrition to prevent kidney damage? Can one of you talk about lupus a bit?
I'll take a turn. So lupus is an autoimmune disease. The body is confused about what is self versus non-self. So our immune system is supposed to be fighting bacteria and viruses that get into our body, but instead have taken a wrong turn and start to irritate our own body. There can be rashes, joint pain, there can be kidney problems that develop. There can be many non-specific symptoms like fevers and headaches. So that's lupus. I don't know of any particular studies about nutrition and how it affects lupus, but I can make a hunch that the plant-based diet is very reduces inflammation, has been shown in a few studies. So I don't know about any specific lupus studies, do you, Shivam? But in general, I would think it would be beneficial.
Yeah, so there's a couple of doctors that have talked about plant-based diets and the role of inflammation in autoimmune diseases. There's a doctor, I think her name is Brooke Goldner.
Yes.
Goldner. And she has written on a few things in regards to lupus and plant-based diets, and even patients with kidney disease from lupus and plant-based diets. That she published a couple of years ago a case series of, I think, 2 patients that were eating a plant-based diet and had improvement in their kidney disease. It almost seemed too good to be true, so I was kind of waiting to see the follow-up data. But a lot of people credit the antioxidants, anti-inflammatory effect of healthy foods, fruits and vegetables, with some of the reductions in inflammation that they're seeing in autoimmune diseases. It's not the gold standard, so this is off-label, so it's kind of it may work, it may not, but if your doctor is telling you to take medications or do something, definitely do that while also trying out a diet. I wouldn't replace one with the other.
Great, thank you. And here's a comment from Elaine, our kidney donor volunteer, who we are just so amazed at. Elaine says, studies show that tart cherry juice will provide the same anti-inflammatory and pain relief as Advil, so one of the ibuprofen.
So you rub it on the joint?
That might hurt a little.
Does it stain clothing?
Right. Going back to what you had said before, Dr. Ettinger, I guess this is a clarifying question. So you're advising that when kids eat a whole food plant-based diet, if they haven't hit puberty yet or finished going through puberty yet, go with a higher fat content.
Yeah, following their growth curves, making sure that they're growing, and their body weight, BMI, things like that. So if anything, just to want to be clear that the same whole food plant-based diet that's good for adults for reducing weight and reducing hopefully disease isn't necessarily appropriate for an elementary school kid. And you really have to make sure, like I said, they have smaller stomachs, more fiber can fill them up quicker. So you want to make sure that they're getting adequate calories. And the fat is also good for brain development and vitamin absorption, the fat-soluble vitamins. So all that's important for the younger kids. Just takes a little more thought in feeding them rather than just grabbing the local fast food or whatever's most convenient.
I can attest to that.
Yes.
we do our nut butters and avocados and
yes, nuts
and seeds and all the right. Yep, great. Faith also asked a great question. Can taking too many different types of vitamins affect the kidney?
Vitamin.
See the full, oh, there we go, it's back.
So vitamins such as D3, vitamin C, vitamins for joints, vitamins for brain, probiotics. What do we know about supplements and kidney health?
Some are necessary, like the ones that your doctor may recommend. So on that list, I commonly tell folks that live, my patients, that to take vitamin D because we live in the north, we don't get a lot of sunlight, so almost everyone's vitamin D is low, and most people end up being on vitamin D, especially during the winter time. Some of the other stuff, I just had a patient yesterday. She had a list of more than a dozen, almost approaching 24 vitamins and minerals and supplements that she was taking. And a lot of them she did not need. I think we whittled it down maybe to 3 or 4. And the big concern, it could potentially cause kidney problems. We don't know all the ingredients in there. They're not regulated. Some of them could be causing harm. The bigger concern is actually with the liver. A lot of these supplements actually can have nasty effects on the liver. And I've seen that in my own practice before. Dr. Ettinger, any comment there?
Oh, just that there are some weight loss supplements that people buy online that can cause a tubulointerstitial nephritis. There's these Chinese herbs that get put in. I'm forgetting the scientific. Have you heard of this?
Or is it Ristolochia?
Yeah. Thank you. That it's an herb, a Chinese herb that's been showing up in some weight loss products that you might buy online, and it can really inflame the kidneys and shut down people's kidneys. And every once in a while, it seems to pop up in the medical literature. So that's something to be careful of.
Good. Yeah. And I think just in general, when we talk about a whole food plant-based diet, we're talking about getting our vitamins and minerals from the plants primarily, but then using these supplements as needed, only when needed, right?
And a lot you're going to pee out. The water-soluble vitamins, you're just going to pee them out. So you can also just flush the money down the toilet to the same effect sometimes.
Yeah, they're very expensive. Yep.
And then vitamin C can cause kidney stones.
Yes. It turns into oxalate, right?
Right. And then vitamin B12 is useful and necessary for those eating a plant-based diet, but a lot of the other stuff is probably not needed.
Yeah. But you're saying, so the vitamin C in supplement form is going to promote kidney stone formation, or is it also from foods in general?
People with kidney stones are recommended not to take vitamin C supplements. You can have all the fruits you want, but not to take vitamin C supplements. For someone with questions about vitamins, there's a program called Chronometer. Have you heard of this? It's free. You can log in, set up an account for free. You track your food for a few days, just plug it in. It's got a big database, and it's got 82 micronutrients that it reports on. You can find out if you're getting enough selenium per day, enough copper per day, and you can really get when you click on it, you can see it'll give you suggestions even as to where you can make up any deficits that you might find with foods or supplements. So it's a free program, and I use it. It's fun to play with.
Great. I have one more question I'm going to ask before we close. Faith asks, isn't there a test to have an early status of kidney function? As you mentioned, Dr. Joshi, most people aren't going to find that they have a problem with their kidneys until it's pretty late. So what do we know about testing and earlier detection?
Is there a new test to detect kidney dysfunction? The only new test I know of is the cystatin C, which is not really new, but it has gained popularity because of the controversy with using creatinine and the formula they were using previously. But commonly, even in my own patients, I almost always use the creatinine, and then here and there I might add the cystatin C. It's just a little bit more expensive, but it's covered by insurance. But it's not really necessary most of the time when I'm checking creatinine. I'm getting the information that I need, unless there's some unique circumstances that may throw it off. But just a routine blood test will detect kidney problems for most people, and then a urine test completes the testing in terms of protein in the urine. So blood test, urine test, and if both are good, you're okay.
Yeah. I would add that genetic testing has come a long way and is going to go even further. Right now, we can get a genetic test result back within about 3 weeks. It used to take half a year, but when that test result can come back within less than a week, then people will be doing genetic tests before kidney biopsies, because you'll make the diagnosis. Now you get the kidney biopsy test back within a week. But imagine the day when you can get a genetic test back even before the kidney biopsy. Kidney biopsies might become obsolete.
That's fascinating.
That's true.
Yeah. Thank you both so much. This was really enlightening. Like I said, the kidneys are mysterious for those of us who don't live and breathe them every day. But really, I appreciate everything you've brought here. And of course, appreciate your incredible attention to lifestyle in treating and helping people through various forms of kidney issues. So thank you so much. Great to have you with us.
Thank you.
Thanks for having us.
Thank you. And thank you all for joining us. Coming up in the week ahead, we are closing out Plant Powered Metro's 3rd anniversary month with neighborhood dinners at 8 different locations, all on Wednesday evening, the 30th. And then we'll spend the month of April exploring the intersections among human health, environmental health, and plant-powered eating as a tremendous collective response to climate change. You can find more information about all of these opportunities on our website, and we're now going to put that in the comments feed as well. Thank you again for joining us, and I wish you well and wish you great health.